Why would you not explore something that would give you a wider scope for your practice? I'm Winnie Akinyi. I'm a fascia manipulation provider at the Human Garage. I did my bachelor's degree in physiotherapy at JCOT.
Yes.
Yes.
And currently?
And currently, I am doing a specialization in fascia manipulation, which is the method that we practice at the clinic. Fascia manipulation has given me a broader picture and a more diverse way of looking at the patients, especially in terms of the conditions that we handle. You find that the scope of practice is quite broad. You get to see a lot of conditions. Like in my case, I'm seeing some of conditions that I didn't know I would be able to see. Yes. Just with my BSc, but now I can be able to resolve things like maybe migraines, gut issues, chest issues, a lot of many conditions which would not have been possible just with my degree. But now, having studied fascia manipulation, the practice is much deeper, more complex, and the results are much better. I'd say neurological cases. Yes. Because the progress is not as fast as maybe internal dysfunction or muscular presentations. So you find that it takes a bit of patience, both from the provider and from the patient, because the nerves, they don't respond quite fast as we want them. So sometimes it can be frustrating. Absolutely.
Why?
Why would you not explore something that would give you a wider scope for your practice? Because you'll not be limited only to musculoskeletal condition or to stroke. You'll be seeing patients who are having internal dysfunctions like digestive issues, people who are having chest issues or chronic chest conditions, migraines, a lot of many conditions. So you're not limited to a certain scope, but you can be able to help a lot of people. Well, that's an interesting question. So far, we've delved in on level 1 work. We've not yet completed the whole of the thing, but we've done a good percentage. So most of the time, Dr. Missy and I usually ask them random questions to test their understanding on the theoretical part. And then with palpation, we've also done a bit of palpation. So anytime you can pick one of them and ask them to locate for you a point, to position the patient in a treatment position and how they will perform the treatment. So it's usually a random thing to test whether they are understanding or it's more of cramming, because fascia manipulation is more of understanding. Medical doctors, physiotherapists, manual therapists also.
Yeah.
Yes. Hand skills.
Yes.
Learning to feel with the hand. I never used to have that skill. When I started practicing fascia manipulation, it was quite difficult to know what to feel for, especially with the fingers. But the most difficult one was feeling with your knuckle and the elbow. But it is something that I came to learn and it became part of me. So knowing that your hands are powerful is the skill that I've learned from fascia manipulation. I think it's going to be the most preferred method. Yes. First reason is because with fascia manipulation, once you've done your palpation on the patient and you've done your treatment, a good release of the treatment, the results are long-lasting. So the patient will not be going, coming back to you, going, relapsing, coming back to you. So looking at the future, I think with how the stakos have really organized their work and in a very practical way, it means that it's going to be something that will be very reliable in treatment of not only musculoskeletal condition, but looking at the body holistically, even internal dysfunction, things that are emotions, because sometimes people don't recognize that emotions could contribute to pain. But with fascia manipulation, you're able to see the bigger picture. Yes.